Hello, my name is Arvin. I'm second year medical student. Can I know your name and age, please?
My secondary school.
Okay. Today I'll be examining your eye and ears. Is that okay? Okay. The instruments required for eye examination is Snell's chart, pupillary size chart, ophthalmoscope, two light pens, and a red target. Okay. The anatomy of the eyes: lateral chondra, medial chondra, sclera, pupillary, and iris, and upper eyelid and lower eyelid. Okay. Do you have any past history of eye surgery? Do you wear any prescription glasses? Okay. Okay. Next week we're doing our visual test.
For the visual NQT test, I have asked the patient to stand 20 feet from the Snellin's chart. Please cover your left eye with the card that I gave. Okay. And read the smallest print you are able to see.
PECFZO.
Okay. The patient's visual acuity is 20 by 30. The numerator denotes the distance at which the patient is standing from the Snellin's chart. The denominator denotes which a normal patient can read. If the patient can read 5 to 8 letters, I will ask them to read the line above.
Next we'll be doing our visual field test. Visual field test consists of two types: static wiggle finger test and kinetic red target test. For the static wiggle finger test, I'll be placing myself an arm's length from the patient, and I'll keep my hands lateral to the ears, and I'll be wiggling my hands forward to the center view of the center of vision of the patient. Next we'll be doing our kinetic red target test. For this test, I'll be placing the red target obliquely to the patient, and I'll be bringing it forward to the central vision of the patient. Tell me when you first see the red target, okay? Patient's peripheral visual field is intact. Now we will go for the inspection. The eyebrows are well aligned. The eyebrows are well aligned and well distributed. The underlying skin, there is no scaliness of the underlying skin. There is no opacity in the pupil. The eyelid closure is normal. There is no edema. Okay. Next, we will be inspecting the lacrimal gland. There is no excessive. There's no tears, or there is no excessive dryness. Now we will be examining the iris. For that, I will be shining a bright light temporal to the iris. There is no presence of bristling shadows, so which is normal. Okay, now I will be examining the pupil. The pupil are symmetrical. Now we will be examining the pupil size with the pupillary size chart. The pupil size is 3 to 5 minutes. So now I will be doing the light reaction test. First I'm going to do the direct light reaction test. For this test I will be placing my light source oblique to the left eye. Okay, so now I can see the pupillary constriction. So now I'm going to do the chronic light reaction test. For this test, I'm going to take two light sources. One light source I'm going to place obliquely towards the left eye, and the other light source I'm going to place laterally to the right eye. In this light reaction test, we are going to check the right eye constriction. So I can see the right eye constriction. Okay, now we are going to do the near reaction test. For this test, I will be moving my fingers towards the bridge of the nose of the patient and ask the patient to follow my fingers. I can see it converging. Next, I am going to examine the extraocular muscle movement. For this, I am going to ask the patient to follow my finger as I place as I move my hands in the H shape. Pausing for extraness. Passing again for mid-sternus. Okay, the patient's extraocular muscle movement is intact. Now we will be doing an ophthalmoscopic test. For this test, we have to darken the room. I've set my ophthalmoscope up into the patient's cover. I'm in a distance of 15 inches from the patient. The angle of 15 laterally. Now I'm going to examine the patient's right eye. So I'll be using my right eye. I can see the light reflex, and there is no opacity. I'm moving further in. I could see the optic disc, which is yellowish in color, and I could see the physiological cup, which is whitish in color. The optic disc margins were normal. The optic disc margins were normal, and I could see some blood vessels also. So that's all for the ophthalmoscopic test, and that's all for the eye examination. Okay, now I will be examining the ear. For this, the instrument required are tuning fork of 512 Hz and otoscope. Okay. Do you have any past history of ear surgery? Okay. First, I will be examining the ear. There is no signs of lumps or lesions or swelling. Okay. Now I am going to examine the extraordinary ears by pulling the ears. Okay. Tell me if you feel anything. Okay. Now I am going to examine the tragus and the mastoid bone. Tell me if you feel anything. First, I'm going to start with the whisper voice test. For the whisper voice test, we have to start. I'm going to stand 2 centimeters behind the patient and rubbing the tragus of the non-testing ears and closing the ears. And I'll be whispering a set of words and numbers.
1, 4, 3, 4, 2, 1. I do.
Okay, in this the patient was able to hear all the 3 set of combinations. If the patient is able to hear at least 3 out of 5 combination, then the whisper voice test is normal. Tuning fork test. First, I'm going to do the Weber's test for lateralization. For this, you need a tuning fork of 512 Hertz. I'm going to give a slight vibration to my tuning fork and set it on the midline of the head. Tell me when you hear the vibration stop. Yeah. Okay. Yeah, if the patient can hear in the impaired ears, then it is conductive hearing loss. If the patient can hear in the unimpaired ears, then it is sensory hearing loss. Next, I'm going to do the Reynolds test. In this test, I'm going to set my tuning fork with a slight vibration and place it behind the ears in the mastoid bone. And later, I'm going to place it near to the ear and tell me when you hear the vibration stop. Okay? Yeah. Okay, if the air conduction is greater than the bone conduction, then it is normal or sensory hearing loss. If the bone conduction is greater than the air conduction, then it is conductive hearing loss. Okay, now I'm going to do the examination with an otoscope. I've set my otoscope on larger spectrum. Now I'm going to examine the patient. There's no, I checked for airbags, no discharge, no swelling. I could see the tympanic membrane, the handle of malleus, the cone of light, and the shortness of malleus, and the tip of the handle of malleus. I could see umbo. I could see the past vision there and past tensa superiorly. And there was no